Hello, and thank you everyone for tuning in today to Mayor Bowser's pre-summit conversation series. My name is Dr. Faith Gibson Hubbard, and it is an honor to serve as the first executive director of Mayor Muriel Bowser's Thrive by 5 DC. Well, by now, I'm sure everyone knows that the countdown is on and everyone should get excited because next week, kicking off on Tuesday, September 15th at 2 p.m., our bold leader, Mayor Muriel Bowser, will virtually host her third National Maternal and Infant Health Summit. And this year's theme, Rethinking Our Perspectives, Retooling Our Action, a life course approach to improving maternal and infant well-being, is just the challenge that we all need to continue to work collaboratively towards healing our communities and improving the well-being of pregnant persons, families, and our babies. The kickoff will be followed by a week, a series of breakout sessions, which we are extremely excited about. So from Wednesday, September 16th through Friday, September 18th, there will be a series of community and parent-led sessions, which will be really exciting, and we look forward to you joining us for that. But before we get started with our exciting conversation today, I want to encourage you to right now log on to dcmaternalhealth.com and register to join us for this year's summit. The summit will feature these discussions that I just mentioned to you. It will be community-led and also have a virtual resource expo dedicated to connecting district residents with local and national resources. And because we want to do more than just really survive during this particular time, we always want to be able to thrive. And did I also mention that Dr. Anthony Fauci will be there? I definitely think that you should too. So don't forget to register, and you can go on right now to dcmaternalhealth.com and do so. So I'm excited about our conversation today. Hi, Stacy. It's great to see you.
Great to see you too. So good to be with you.
It's always great to share this time with you. So for those of you who don't know, and I can't imagine who wouldn't know who Stacy Stewart is. She is the president and CEO of March of Dimes, and Stacy is responsible for all aspects of the organization, from the vision and operation of March of Dimes, and helps to lead the fight for the health of moms and babies, and really so much more. March of Dimes is an amazing organization. So I'm excited to spend this time with you. So let's just jump right in, really.
Sounds good.
To the fact that we are all experiencing unprecedented times, right? But I definitely can't imagine being a parent getting ready to have a baby during this time. And I know that March of Dimes does so much and has for many, many years. I mean, it's a long-standing organization. But what are some of the things that you're seeing right now that are some of the most pressing issues for moms, babies, and families?
Yeah, no, it's a great question. And I mean, this has been kind of an unprecedented time for so many moms who are pregnant. Many of them didn't anticipate having to deliver birth. Many of them, at the beginning of the pandemic, rethinking whether or not they should even start a family, given where we are. So it's been very stressful for a lot of women, a lot of families. And so a lot of what we were seeing and hearing, and it kind of changed our whole world at the March Dimes, was that we were obviously trying to scramble to get as much information, working with scientists and researchers and health systems, so that we could pass that information on, credible information, in a really timely way to many women, so that they could prepare themselves as much as possible for what to expect during the pandemic. We launched a whole webinar series on a weekly basis just to get information out to women. We created and launched a COVID fund that could actually fund some research to keep us up to date on what women are experiencing. We've been tracking the research to see what is being looked at with respect to the pandemic. We know that early on, for example, it wasn't clear that there was any vertical transmission of the virus between mom and baby. Since then, we've seen other information come out that it can't be eliminated or excluded, that there could be a possibility of vertical transmission. Obviously, we've seen a lot of issues with children, young children, where they've gotten really sick from the disease, and then some other information about transmissibility among young kids. So there's just information that's all over the board and all across the map. And so what our role has been is, one, to reach women where they are. We know many women have not been able, and we're concerned about even going into follow up on their prenatal visits. We've seen a lot of women say miss a lot of prenatal appointments because they were too concerned about going into the doctor's office. We've seen a lot of doctors' offices adjust to that and try to make their offices as safe as possible. And we've been trying as much as possible to encourage those prenatal visits. We've actually taken a lot of our content from a lot of our programs and made them virtual. So a lot of our information is online. We virtualized some of our programs available to women in the NICU to make sure that we can, where we've had staff in NICUs around the country, like at Children's National and others, we've tried to make that information available to families in the NICU via iPad and virtual means. I mean, it's just been an incredible, stressful time for everyone. I do think it's really encouraging, though, that women are learning how to reach out for help. They're learning how to not only manage their physical health, but also their mental health during this time, which is really important. We've seen a lot of therapists and psychologists and others making their services available by virtual means. Telehealth has become huge in this world. So and we're not even done with it, right? We now are in a new normal where we think this is going to be our world for some time. And so getting adjusted to this way of helping women through this period of time is just becoming our way of life and the way in which we do our work now at the March of Dimes.
Yeah. And you guys are at March of Dimes, such a trusted source of information. I know early on, as many families kept reaching out and asking for, how do I make a plan during this time? You all have
Yes.
a plan that's available
Yeah.
on your site. And that, I always joke about when I had my babies, I made a plan, but the baby really had the plan. But a better
Yeah.
way to be able to think through that, because there can be so much anxiety just around entering into parenthood. But really, in looking at that resource, and we've also shared a lot of the great resources you all have on your site,
Oh, great.
and a great source of support. As many other people were trying to scramble around, March of Dimes was right there with those resources and in a real way that we can see on the ground. So in speaking of on the ground, as we're talking about things that are happening in the District of Columbia, can you talk more about how the March of Dimes is supporting families in the district? I mean, I know you live here in the district, so that's one way,
Yeah.
but in addition,
Yeah.
to that, you guys have a phenomenal footprint even here in the city.
Yeah. Well, there are a couple of things, and we're looking to do even more because, obviously a lot of issues around maternal and infant health are pretty severe here in the District of Columbia, and we all have to do far more than we've ever done before, including the March of Dimes, to reach more women. I think one of the most important things that we're trying to do is address a couple issues. One is access, right? I mean, the great thing about the District of Columbia is a lot of people have access to healthcare, but access also is, are there providers that are near me, that are close to me, that I trust, that I believe are going to serve my needs, that are going to listen to me and respect me? And I think we have a lot of healthcare providers that do a great job in the District of Columbia, but we have lots of places in this city and in the district that really are not as well served. And so a big part of our work has been, how do we expand access? So obviously one of the things that we're doing is trying to figure out through mobile health and things like that, how to expand some of those services. And we're working hard we've had a mobile bus that was available in Maryland through some of our Maryland partners. We're trying to bring some of those resources into the district right now so that we can reach especially into wards 7, 8, 5, and other parts of the city that are not well served, to bring healthcare to women. That's been really important in COVID. We've seen in other partnerships, like in New Haven, Connecticut, for example, where that kind of access to mobile care has really been well received by communities of color, women of color, immigrant communities, African-American communities, Hispanic communities, and others. So that's one big thing we're doing. We also launched just before COVID, and we're gonna keep this going as much as possible, with supportive pregnancy care. So group prenatal care programs, working with Trusted, we have been able to launch supportive pregnancy care and really make sure that women get the support that they need. So one of the things that we find with respect to the maternal and infant health outcomes, a lot of the issues that we face as women of color is because a lot of us just don't feel as well supported through pregnancy, right? I mean, you look in highly resourced communities, white communities, there seem to be a lot of resources available to women because of their access, because of their income, because of their wealth, frankly. And that that separation or those disparities based on income and wealth um, should not exist, one. But certainly to the extent that we have communities that may be under resourced, we have to make up the difference, right? We have to make sure that those women have the same level of support, the same level of feeling of connectedness that's going to make them reduce their stress, reduce their anxiety during pregnancy, and hopefully produce better outcomes. Group prenatal care has been proven to be a great model for that, and so expanding that in the District of Columbia is something that we've been working hard to do. I think the other thing is we have incredible partnerships with the Divine Nine organizations. It's interesting to have a VP nominee and everyone now in the country, all of us that are a
They
part
do.
of the Divine Nine organization. We already know what the Divine Nine is, but there are a lot of people now becoming much more aware of what the Divine Nine is. But we've had historic relationships with Zeta Phi Beta, Alpha Phi Alpha, Delta Sigma Theta, and Sigma Gamma Rho, and so many others. And so we're leveraging those kinds of community partnerships. With Zeta Phi Beta, we've had a Stork's Nest program for over 40 years that's helped to provide prenatal education and support to women. So it's things like that we have been doing around the country in the District of Columbia. We want to continue to expand those things, and just deal with the fact that we do have, some really stark and concerning statistics. We're so pleased to partner with Mayor Bowser and you, Faith, because it's only with great leadership will we be able to really overcome some of these challenges that we're facing with respect to maternal and infant health. And we're just proud to be a partner here in the District of Columbia. Whatever we can do and whatever more we can do, we're always happy and pleased to step up and do more.
Yeah, and we're so honored to have your partnership as well. And I know that for me and many other moms that we just talked about, seeing your leadership is also something that's really phenomenal. To see a Black woman at the helm of an organization really focused on this topic, I think definitely signals just how important it is. And also you have shared experiences
Absolutely.
that many can connect to. So I think that partnership is really just amazing. And I laugh about the Divine Nine because as soon as the Democratic VP candidate mentioned Divine Nine, I know the internet was blowing up trying to figure out what those organizations are, and very proud to be a part of those, and also to see just really the manifestation of some of those things you talked about. Last year, we featured the Stork's Nest and also had the International Basilisk for Zeta Phi Beta, or is it President, join us.
Yes.
And
Uh-huh.
he was really phenomenal in talking about their work, but just how important it is with the partnership of March of Dimes, because I think when you go back to the word trusted, and that's something you said earlier about the providers, when we look in the district, there's care, right? But I think that trusted word is why some people don't step through the door.
That's right.
Trusted is really important. And just the recognition that we carry trauma and lived experiences with us. And so if we believe that once we step over that threshold, we're not going to get the care we need, then that becomes the challenge. But March of Dimes is trusted. And I would love to talk more with you about kind of the new models that you've really implemented in order to further that trust, and also
Yes.
in the spaces of advocacy that you're working on right now.
Yeah, absolutely. I mean, there was an interesting study that was done of Medicaid women in the district. And one of the things that it really talked about, there are a lot of things that were amazing in that, and it really listened to women and what their experiences were in pregnancy. And these were primarily Black and brown women in Ward 7 and 8. And one of the things that really came out was that there were too many instances in which women felt like they weren't really respected and heard when they went into a healthcare provider's office or a clinic. And what's really interesting about that is that it's not only about the doctors and the nurses, it was often the front desk receptionists who, sort of disregarded them or made them feel like they weren't really valued, maybe because they, were met on Medicaid or whatever their condition may have been, or whatever assumptions were a part of the interaction. And I think that's where we get to real problems in the healthcare system, because we tend to look at hospitals and doctors and nurses and forget that the system is far more than that. And so one of the things that we're doing at the March of Dimes, we recognize that this issue of implicit bias was a huge issue. That racism in the system of healthcare is at the core of why we see so many of the disparate impacts that we see with respect to Black and Brown women in particular. And at the root of that is kind of this issue of implicit bias, where some of us make assumptions or carry biases, and all of us carry certain kinds of biases. There's nobody who's human that doesn't do that. But to the extent that we have implicit bias in the healthcare system, and to the extent that that is focused negatively on creating less than desirable impacts for pregnant women, for new moms, we have to root that out. And so we launched an implicit bias training program. We worked with a minority-owned firm to develop it, and are offering that to healthcare systems, healthcare providers, doctors' offices. And when we go to a hospital system, for example, we encourage every single person in the system, not just the doctors and nurses, but the receptionists, maybe the janitorial staff, anybody who's interacting with patients at any level really needs to be a part of this. So that's one thing we're doing. But, you know, to your point, Faith, advocacy is at the, if we're going to really sort of get at the root of some of our challenges, we've got to really face what kind of not just incremental policy change we need, but sort of monumental policy reform that we need to really get at some of these issues. And I think what the March Times is really trying to do now is especially focusing on the upcoming November elections, to use this as an opportunity, one, to bring attention to some of these issues. We have been an active supporter of the Momnibus legislative package that has been put forward by members of Congress, especially the Black Maternal Health Caucus. And big shout out to Congresswoman Lauren Underwood, Congresswoman Alma Adams, then now Senator still, I guess, Kamala Harris, who, and many other members of Congress who've now signed on as sponsors of that. This is a package of legislative bills that will address everything from funding of community-based organizations to expanding Medicaid to 1 year postpartum to really looking at the issues of medical education and how we deal with the issues of racism in our medical education system, a whole range of different issues that need to be looked at that we think are fundamental to the maternal and infant health disparities we see. So the advocacy part of us at the federal level, and I would say at the state level, is really important, because we know a lot of healthcare decisions get made through state policy. And so we're really actively working in states like New Jersey and Texas and many others to address these issues. The last thing I'll just say is that this month of September, we'll be reissuing a study that we did a couple of years ago around maternal care deserts. We found that 35% of all counties in this country, and we would count Ward 7 and 8 as one, a maternal care desert. But we looked at 35% of all counties in this country were considered maternal care deserts. In other words, had no access to a hospital that offered obstetric services, no OBGYN, and no certified nurse midwife, affecting about 5 million women in this country. About 10 million women have very limited access. So a part of our focus is also going to be that we've got to figure out, and maybe the silver lining in coronavirus is that if we can get much better at offering help to women through virtual means, telehealth, maybe we can access women in hard to reach places if we have good broadband and good access, digital access. But I do think it's really important to understand that we have huge gaps. So again, even where we have coverage and where we've expanded Medicaid, we may not have the access to care that so many women need in this country. And until we deal with that, we're still going to have tremendous challenges in terms of outcomes. So that's another part of our policy focus as well.
Yeah, I think, well, we're working on the hospital, you know.
I know you are.
We are working quite hard at that, and not only for just be something that sits there in the distance that people can have access to, but I think it goes back again to trust and knowing that it's the type of quality and service
absolutely
that families want for their holistic care and needs. And so we're definitely working on that. And I think so much of what you said as well around this mobile access, I think, is something that we're also exploring even in the district through immunizations right now and school health centers. And I know DC Health has been working very diligently to make sure that we just don't have something that's standing there, but is also the quality that the community deserves. So I'm sure that you'll help to really push that forward. And so I'm excited for many of our communities to really see that type of access and trusted
Yes.
resources and services that they deserve.
And can I just say one other thing, Faith, which is that, and you guys are making such great progress on hospital access to care. I think I think the entire country needs to look differently at what it means to safely deliver, especially if you're a woman of color. And I think we need to reintroduce. We have created a highly medicalized um, system for pregnancy care and delivery. And there, of course, are many instances in which, especially with high risk pregnancies and others, where women need hospital access. There's no question about it. I think in addition to that, though, we need to also make sure we're creating a system of care that gives women choice in terms of, and culturally competent choices, right? Where we know doulas and midwives often can provide high quality care, can reduce some of the negative pregnancy outcomes when done properly and appropriately with a highly trained group of providers. And so I think what we're working on in many parts of the country and would love to work on in the District of Columbia is how do we create a system of care with a variety of different providers who are highly trained, women who can be compensated for their excellent work and their care, providing support to women of all income ranges, of all backgrounds and ethnicities and races. And so this idea where others have really pioneered and really looked at expanding access to doula care and access to care by highly trained midwives is really something else I think we ought to look at and give women the choices and the support that they feel they need, because every woman's different and every woman wants maybe a different experience. And even despite her income or where she lives, that shouldn't limit her access to the kind of high quality care that she might want to choose for herself and her baby.
Yeah, so true. And I think just even the knowledge of it, right? I think about having a baby myself, well, two babies, and the first thing you think about is going to the doctor. You don't think about what the system of care could possibly be. And even coming into this role, when I've met some really phenomenal doulas or midwives, I'm like, oh man, I'm not having any more children. But if you go back and do it, I wish I would have known, because sometimes the way in which that system of care is offered is not really marketed to all, right? In a way that seems accessible. And so I definitely agree with that system of care and just how much it really does. That system of care can really hold up what we have and insert that trust that many people are looking for, I think will be just really great. But just that information and to know, and also to realize midwives and people who served as doulas, that's been going on since our nation's, the birth of our nation, right?
Let's just understand our history and then we would know that, right? Exactly. Where most midwives at one point were African American and they were delivering all the babies, right? I mean, women weren't delivering in hospitals. So, I mean, yes, exactly right.
I mean, I even think about my grandmother and my mother and their experiences, and my grandmother having my mom, which was not that long ago. And that was through a midwife. So I think it's, we don't even talk about that. So even the oral history we could share with each other in order to help us make better choices. Um, and not to think that pregnancy is a adverse condition, right? But it should
Right.
be a joyous time that we should be able to get excited about and feel safe through the process. So I know our time is coming to a close, but I want to make sure to just talk about two things in particular. So maybe we can put them together, about both the priorities of the March of Dimes over the next year or two, and also how people can not only know about those priorities, but connect to your work.
Yeah. Well, if you go to marchdimes.org, you'll see a lot about our policy agenda at the federal level. There certainly are ways to sign up on our website to become an advocate and to become a part of our work. The other thing that we're doing, like we did 2 years ago when we launched that Maternal Care Desert Report, we also launched something called Blanket Change, where we laid 700 blankets on the National Mall to memorialize the 700 plus women who died as a result of pregnancy and childbirth. We're launching this, and that was done in advance of the midterm elections. Then we're relaunching, I think, version 2.0 of Blanket Change in advance of the presidential elections and also the congressional races that are going to be going on at the same time, some of the state races as well. The idea here is to activate people to make sure that when it comes to maternal and infant health care, that there's a policy agenda that we would hold everyone accountable for at all levels of government, especially at the federal level, but even as it relates to state policy change as well. And we're going to be launching Blanket Change 2.0 at the end of September. So look out for that announcement on our website. And if you sign up for our advocacy network, you'll probably get alerts and texts about it. But what it's going to allow you to do is really reach out to those candidates and demand that they take a stand for moms and babies. And I think even those of us in the District of Columbia, I mean, obviously we know the state of our representation in the District of Columbia, but it doesn't mean that even if you're in DC, you can't activate around this, especially with elected officials in the DMV area or elected officials wherever they are, right? This is a national issue. And if we get national policy change, it's going to help all of us, including the residents of DC. So we want everybody to get involved in this, and especially on some of these issues that we've been talking about, like expansion of Medicaid. We know that there's evidence that shows that when in Medicaid expansion states, we've seen improved outcomes for moms and babies, improving maternal and infant health outcomes. And so we know that some of these policy solutions can be the start of moving us in the right direction. We know that if we start to really address the issues of racism in our system, that we can start to get at the root cause of some of the disparities that we see. And some of the policy changes that we're looking at will address that as well. So this is really a time for all of us to get really involved, and going to the marchofdimes.org is a great place to keep up to speed on what we're doing. Follow us on social, follow March of Dimes or March of Dimes CEO, that's me, and I'll try to keep everybody as updated as possible on everything that we're doing and try to get everyone involved.
Yeah, and you do a great job of that. I follow all of those handles on all social media outlets, and I have to say you do a very good job of that. And I think that's one of the great parts about March of Dimes is the way in which everyone can really be an advocate and feel as if they can do something, because we all have a role to play in improving maternal and infant health outcomes. There are elected officials and they have their roles, but we also have a role, just private citizens. And so I think March of Dimes gives you kind of your marching orders, literally, as to what you can be doing in order to fulfill your role in around advocacy. So I just want to thank you so much for sharing this time with me. It was really
Thank you so much.
You guys have so many good resources, and I just want to continue to encourage everyone to go check out March of Dimes resources and find ways to continue to connect, because I think it's going to be really important, not only just in terms of the summit coming up next week, but also just as we look forward, because this time of COVID is really highlighting a lot of the inequities that we already knew were there, already a lot of the challenges that were already there, but just giving us a different view. So thank you, Stacey, for helping to put all that in perspective and to just share this time with us. I appreciate it.
Dr. Gibson Hubbard, I appreciate your leadership. You always do a magnificent job. And Mayor Bowser, let me just say before we go that, I use her as an example of the kind of leader we need at the state level. That can fundamentally drive the change, raise the awareness, build the awareness of these challenges, and actually she's got plans to back it up. And that's what we need going on in every single state in this country and every single territory. So thank you so much to Mayor Bowser for everything that she's doing as well, and for the summit, and for inviting all of us as partners to be a part of working with her. So we appreciate it very much.
Yes, and we all appreciate her vision, and the summit is definitely a part of fulfilling that vision and seeing it in action. And so on Mayor Bowser's behalf, the entire conversation today was on her behalf, but I want to thank everyone who joined us for today's conversation. And just as a reminder, to go right now to dcmaternalhealth.com and to register for this year's National Maternal and Infant Health Summit. It will be held starting Tuesday, September 15th through Friday, September 18th. And again, you can register at dcmaternalhealth.com and find all of the information about the agenda. It's a exciting 4 days of events, and I can't wait for us all to engage together in those events. And if you want to learn more about Thrive by 5 DC, I definitely invite you to visit us at Thrive by 5. So Thrive by the word 5, .dc.gov, or on social media, all outlets at Thrive by 5 DC. So we'll see you next time. And thank you again, Stacy, for sharing this time with us.
Thank you so much. Great to see you. See you soon.